there and welcome back. Welcome to my fourth video in the diabetes series. Today I want to talk about what it means to have a controlled blood sugar. We talked a lot in the last video about uncontrolled diabetes, so what does that really mean? When we're trying to determine if a patient's blood sugar is controlled or not, in addition to the blood sugars, we look at a number called the hemoglobin A1c. Now, the hemoglobin A1c is a lab test that we measure about every 3 months, and it gives us a really good idea of what the patient's blood sugars are on average over that 3-month period. A normal hemoglobin A1c in a non-diabetic patient is 5.6 or below. Prediabetes is defined as a hemoglobin A1c of 5.7 to 6.4, and diabetes is a hemoglobin A1c of 6.5 or above. Now, for diabetic patients, we're not trying to get your A1c down to a normal A1c because we don't want to put you at risk for having low blood sugars. But usually patients will have a goal A1c that we're working towards, and most of the time it's less than 7. An A1c of 7 is an average blood sugar of 150. So we usually want those blood sugars to be less than that. That is the magic number that will help us prevent, as much as possible, the complications of diabetes that we talked about the last time. Some patients have a goal of less than 8, especially if they are elderly or are very prone to having low blood sugars. Then the doctor might give them a higher A1c to work towards. As you can see, I've written down the A1cs here, and I'll go through those with you. So like I said, an A1c of 7 is an average blood sugar of 150. 8 is 180. 9 is 210, 10 is 240, 11 is 270, and hopefully we're not seeing too many A1Cs in this range because these blood sugars are very uncontrolled. 12 is 300, 13, 330, 14, 360, 15, 390, and 16, I do see some 16s sometimes, is 420. So definitely that should give you an idea of what your hemoglobin A1c means when the doctor tells you this is your A1c. There are some things that can occasionally cause the hemoglobin A1c to be falsely low or falsely elevated. So if your hemoglobin A1c doesn't match up with your blood sugars that you're checking at home, then it's likely that your A1c may be off some, and some things that can contribute to that would be anemia or blood loss, pregnancy, kidney disease, recent episodes of diabetic ketoacidosis. All of these things can cause false lows or false elevations in the hemoglobin A1c. If you really want to be certain of what your blood sugars are doing, then it's a good idea to check your blood sugars a few times a day, at least probably before every meal. So the first one should be fasting before breakfast, and then before lunch, before dinner, and again at bedtime. And that will give you a really good idea, if you do that for several days, of what your blood sugars are actually doing. And then if you take that with you to your doctor's appointment, then your primary care provider can adjust your medications based on what your blood sugars are doing, in addition to just looking at the A1c. So try to keep those blood sugars well controlled, because like we said in the last video, if the blood sugars are well controlled, then we can hopefully prevent all of those complications that we talked about, or at least we can prevent them from getting worse. As always, if you have any questions about your A1c or any general questions about blood sugar control, feel free to post your question in the comment section, and I'll answer it to the best of my ability. Don't forget to share the videos. If you feel like your friends or family might benefit from it, any healthcare professionals, nursing students, anybody else that might benefit from the videos. And don't forget to subscribe to my channel. Have a good night.